At what point do you think we should be referring to a dietitian? Do you think every person who is struggling with diabetes needs a dietitian, or maybe can some be managed with their primary care physician?
I think ultimately, when it comes to food, there's a lot of misinformation. So seeing that dietitian at the minute that patient is diagnosed is going to be extremely beneficial for the patient, because patients are also seeking social media or they're searching on the web for information, and they might be able to manage their diabetes for a substantial amount of time, but sometimes we don't know exactly to what extent. We want patients to implement a change that is going to be realistic and sustainable long term. And even though we might feel like that patient is doing great, we really don't know the ins and outs or the nitty gritty of their diet, because we're not taking the time to ask those questions. And that's where, as dietitians, we come in and we're doing the nitty gritty when it comes to figuring out what they're eating, what their day-to-day lifestyle looks like, what are the resources that they have. All those things play a role in regards to food access. So it's very important to think about it from the perspective that nutrition is not black and white, and that even though we might feel like the patient knows, the reality is that they don't.
Yeah, and I cannot agree with you more, the importance of getting a dietitian on board, even if it's only for a few visits. But dietitians clarify so much, and you guys do have the time. You ask the right questions. It's so much different than when a clinician says, okay, here's a meal plan, follow this and good luck. And they maybe don't see them for the next 3 to 6 months. So I really agree with you. I think getting a dietitian on board is so vital.